Dear friend, today we will see the pons. Today the external feature. External feature. Pons, if you see the meaning of the pons, pons is a bridge because pons make a bridge between the two cerebellar hemisphere, and here the fiber from the pons passes towards the cerebellum, both cerebellar hemisphere. So it acts as a bridge through which the fiber from the pontine nuclei passes towards the cerebellar hemisphere. Now, come on the diagram first here. This is the midline axis. Here we already know the diagram of the medulla. This is the medulla, these are the pyramid. These are the olive. Okay, here this is the pons. Okay, here, and this pons superiorly continue with the midbrain. Okay, here. Now, this pons inferiorly continue with the medulla oblongata with the ponto-medullary junction. Superiorly it will continue with the crus cerebri and midbrain here. Now, this pons here on the ventral aspect is a groove here. This is not the basilar groove. Here, this one groove is there. Basilar groove where the basilar artery runs. Okay, here. Now, on the anterior surface here, there are the striations. The transverse striations are here. These are the transverse striations. And these transverse striations are due to the fiber bundles which runs horizontally from the pontine nuclei and reaches towards the opposite cerebellar hemisphere here. So these are the transverse striations present. And these transverse striations are intermingled with the vertical fibers which descends downward, and these fibers are the fiber of the corticonuclear and the corticospinal tract here. Corticospinal fiber descends downward, corticonuclear fiber and the corticobulbar fiber descends downward through the anterior surface of the pons. Okay, so transverse striations are intermingled with the corticonuclear and the corticobulbar fiber here. Now, on the ventral aspect of the pons, there is the attachment of the fifth nerve by the two roots, the large lateral sensory root and the medial small motor root here. So, this is the large sensory root and the small medial motor root. And this root here, this attachment of the fifth nerve here, demarcates the junction of the pons and the middle cerebral peduncle. This is middle cerebral peduncle through which the pons is attached to the cerebellum here, and the fiber of the pontine nuclei passes here. So the fifth nerve demarcates the junction between the pons and the middle cerebral peduncle here. And at the junction of the medulla and the pons here, there are the nerves. That is, this is here the sixth nerve between the pyramid and the pons, and between the this olive and the pons here, this is the seventh nerve, the facial nerve, and this is the eighth nerve between the pons here and the this olive. Okay, here at the lateral, and then here, and this also known as the cerebellopontine angle at the junction of the where the pons, medulla and the cerebellum meets here. Okay, and this junction is the cerebellopontine angle here, It's very important. The cerebellopontine angle is important because whenever there is a tumor occurs, the cerebellopontine angle tumor is known as, and this cerebellopontine angle, this tumor compresses the inferior cerebral peduncle here, and the sixth nerve, seventh nerve, and the vestibulocochlear nerve. Okay, so this may lead to the ataxia, loss of the equilibrium, and also there is the facial paralysis due to the facial nerve. So this is a cerebellopontine angle tumor. Now, after this here, come on the posterior surface. What about the posterior surface? Posterior surface of the pons from the floor of the fourth ventricle, upper part of the floor of the fourth ventricle here. This is the floor here, and this is the midline axis. Okay, here this is the lower part, the medulla, fasciculus gracilis, and the fasciculus cuneatus. This is the fasciculus cuneatus, and here this is the inferior cerebral peduncle. Okay, here is the tuber cinerarium. Okay, here, and these are the fiber of the stria medullaris. Okay, yeah, and these are the three peduncle. This is the inferior cerebral peduncle, and the lateral, the largest is the middle cerebral peduncle. Here, this is the inferior, and this is the middle cerebral peduncle, and the innermost is the here. This is the superior cerebral peduncle. Okay, here the three peduncle, through which the brainstem is connected to the cerebellum. This is the upper limit. Okay, yeah. Now, and now here this is the lateral margin of the midbrain. These are the four colliculi, two superior colliculi, two inferior colliculi. This is the margin of the upper brainstem. These are the brachium, inferior brachium, and the superior brachium. Clear? Now, look here, this part. This part is the floor, upper part of the floor of the fourth ventricle, which is formed by the posterior surface of the pons. Now, this posterior surface of the pons has the special features. This is in the midline, there is a median sulcus, posterior median sulcus, and on the lateral to the posterior medial sulcus, there is another sulcus here. This is the sulcus limitans. The sulcus limitans. And between the sulcus limitans and the posterior median sulcus here, there are the swelling here, elevation. Here, these elevations are known as the facial colliculus. And this facial colliculus is due to the abducens nucleus and the fiber of the facial nerve which winds around the abducens nucleus and form the genu. That is the internal genu here. Okay, so these are the facial colliculus here, and lateral to the facial colliculus here, this area, these area are vestibular area. Okay, and here on the sulcus limitans in the upper part here, there is a bluish color area here, dark area here. This blue color area is known as the locus ceruleus. This is the locus ceruleus, and this locus ceruleus is the Here the bluish in color due to the presence of the here the adenylene and noradrenaline here chemical here. Okay, so this locus coeruleus, and here the lower part of the sulcus limites here is one fovea is found here. This fovea is known as the superior fovea. Okay, deep to the locus coeruleus there is a nucleus coeruleus is found. Locus, and this locus coeruleus is nucleus coeruleus is a part of the reticular formation because it ascends upward in the midbrain here. Clear? And this is the superior fovea. Yeah. And these are the structure which are on the posterior side of the pons. Okay, we have seen, and these are the middle cerebellar peduncle. This is the inferior cerebellar peduncle, and here is the superior cerebellar peduncle. Okay, here, and these are the, and this whole area is known the median eminence between the posterior median sulcus and the sulcus limitans here. This is the sulcus limitans. Okay, this sulcus limitans, and this area is known as the median eminence. Median eminence, and this median eminence in the lower part here there is a two swellings or elevation. These elevations are known as here facial colliculus. Facial colliculus. Okay, so these are the features on the posterior part of the pons. Now, what is the blood supply of the pons? Whole of the pons are supplied by the different arteries here. Here, this is the in the midline is a basilar artery here, which is found in the basilar sulcus here, and this basilar artery here give rise to the paramedian branches. Okay, these are the paramedian branches which supply the here the pons which is around the just midline. Okay, these are the paramedian branches. Along with here, there are the short circumferential branches here, which comes from this here the basilar artery. This short circumferential branches supply the here the anterolateral part. Okay, suppose here if we divide here, suppose this is the paramedian part. Okay, they are supplied by the paramedian branches, and this is the anterolateral part. Anterolateral part here supplied by the short circumferential branches. Okay, then there are the long circumferential branches come here. Okay, these are the long circumferential branches here. These long circumferential branches supply the this posterolateral part here. Okay, along the cerebellar peduncle here. Okay, here. So these are the posterolateral part, and most posterior part here. Most posterior most part is supplied by the here the superior cerebellar artery here. Superior cerebellar artery comes like this. Okay, here the superior cerebellar artery supply the here the most posterior part of the cerebellum. Along with this cerebellum also supplied by the anterior inferior cerebral artery. Okay, anterior inferior cerebral artery here. This one. This is supplied by the anterior. So anterior inferior cerebral artery here supply the lowermost part of the pons here. Okay, so this is the artery supply of the pons. So we have seen this is the paramedian branches. Paramedian branches. These are the short circumferential branches. Circumferential branches. Here, this area long circumferential branches. Okay, and posterior most possible by the superior cerebral artery and the anterior inferior cerebral artery. Clear? So these are. Now what is the applied aspect? If you see, applied aspect is the locked in syndrome. Okay, that is the locked in syndrome. Locked in syndrome. What is locked in syndrome? Locked in syndrome is here when the blood supply of the pons is hampered due to the thrombosis of the paramedian artery or the short circumferential arteries here. Okay, so when these arteries are thrombosed, what's happened? The corticobulbar and the corticonuclear fiber which descends downward, they are paralyzed, and these fibers supply the nuclei. Okay, here which supply the descending tract here, either the facial nerve or the abducens nerve. Okay, here. So these corticonuclear and the corticopulbar fiber which passes anterior aspect of the pons, they are damaged due to the thrombosis of the artery, and so what's happened? The whole of the body is paralyzed. Okay, except the sensory sensation and the here and the third and the fourth cranial. This third cranial nerve come from the midbrain and the fourth from the midbrain. Okay, so third and fourth cranial nerve persist along with the sensory sensation. Sensory sensation means the ascending tract passes posterior side of the this pons. Okay, while the descending tract passes through the basilar part of the pons. So basilar part of the pons mainly is damaged. Okay, so what's happened? The whole body is paralyzed except the sensation is preserved, and along with the movements of the eyeball upward movements, which is by the inferior oblique muscle and the oculomotor nerve. Third, okay. So patient cannot speak, okay, cannot move, but the patient can communicate through the eye movements. Okay, here, but only eye movement, only the vertical gaze movement. Okay? So this is known as the locked in syndrome. It means the patient is locked in, okay, except the sensory sensation. So this is all about the pons, the external feature of the pons. The next turn, we will see the internal features of the pons. Thank you.